Hello everyone. My name is Ollie and I'm a third-year medical student at Warwick Medical School in the UK. Welcome to the first episode of the PostGradMedic podcast. Here you will find narrated versions of the videos that you can currently find at my website postgradmedic.com or on YouTube under the same name. I hope to publish more episodes relatively quickly, and they are intended to simply provide another free avenue through which you can all access my medical school interview resources. This first episode focuses on perhaps the most consistently discussed topic in medical school interviews, the 4 pillars of medical ethics. I hope you enjoy it, and thanks for listening. Medical ethics refers to a series of principles that, when considered together, aim to ensure that everyone receives the same standard of safe healthcare and serve to guide doctors in approaching the care of their patients. While healthcare professionals must use them each and every day in carrying out their roles, they can also be examined more closely when problems arise to work out exactly how they should be resolved. These ideas are loosely defined in 4 key values, known as the 4 pillars of medical ethics. In no particular order, they are autonomy, beneficence, non-maleficence, and justice. This podcast will address each of these ideas in turn and elaborate on their meaning and consequences for the practice of medicine, which you'll want to be aware of before your medical school interview. We'll explore them more individually in future episodes, but for now, here's a primer. The first, autonomy, is recognition that the patient has ultimate control over whether they receive any treatment or not. Medical practitioners may not force intervention upon them under normal circumstances, be it treatment with drugs or surgery, and to do otherwise would amount to battery under the law. The exception to this arises when patients cannot be deemed able to reasonably make decisions for themselves, for example when detained under the Mental Capacity Act. If this happens, they are considered not able to properly consent to treatment, and may only be treated if it would save their life or prevent serious deterioration in their condition. Even then, some legal documents and directives prevent doctors from acting to save the lives of their patients if those patients have expressed a wish to not receive those interventions. To maximize patient autonomy, steps should be taken to ensure that any treatment options are agreeable to them. It is the doctor's duty to explain the situation completely, including the diagnosis, the full array of treatment options available, and the consequences for each of them. Drugs might have side effects. Surgery might leave significant scars. The patient may equally wish to do nothing at all, and let their condition progress naturally. This is up to them, and a decision that seems unwise from a medical standpoint is not to be taken as a sign that the patient lacks capacity to consent. The second of our pillars, beneficence, refers to the idea of having the best outcome for the patient in mind at all times, particularly when all the options available, of which there may be many, have been considered. It is the duty of medical practitioners to identify which treatment would give the best outcome and to communicate that to the patient. As we've discussed previously, they may not wish to choose this treatment, but you should at least provide the relevant information. Do bear in mind that this could be more complicated than it sounds, as the patient will have their own views about the treatments beyond medical statistics. There might be elements to their lives that make some methods incompatible with their situation, and it's all about identifying the best outcome for that patient in terms of their thoughts and values, and working together to plan a route to get them there. Non-maleficence is sometimes taken as the opposite of beneficence, and is essentially a concise version of the Hippocratic Oath. Do no harm. A doctor should never knowingly cause harm to their patients, as to do so would be a gross abuse of the power differential between the two parties. This is relevant when considering any sort of procedure a patient might need, from taking blood to brain surgery. Nearly all possible gains in medicine come with some element of risk, however small, and often it is better to do nothing at all than take the chance of making a patient worse or more likely to suffer in the future. Of course, harm can also come by neglect. Any necessary tests must be completed in a timely manner, and all possible steps taken to reduce the inherent risks of procedures. This means that doctors must continue to refine their practice and clinical skills, ensuring that important diagnoses are not missed and that tests and investigations are performed safely. A holistic assessment of every patient's situation is necessary to identify all possible sources of risk, be it the competence and experience of the medical practitioner, the circumstances of the patient beyond the hospital, and of course, any potential problems that come with the treatment itself. The last of the 4 pillars, and perhaps the most complex, is justice, which concerns identifying whether or not an action is fair in society and within the realms of the law. As one might imagine, this is no easy feat because of the nuances and subjectivity associated with the idea of fairness. Say you were faced with 2 patients who desperately needed liver transplants and would surely die without them. You have access to one liver, which is compatible with both patients, but you may only choose one of them. The first patient is a middle-aged male with 2 young children and a morphine addiction, while the second is a 16-year-old female who smokes 20 cigarettes a day. In this case, do you choose the option which would give one patient more years of life, or that might result in fewer for the other patient but provides his 2 children with a more stable environment in which to grow up? Or do you do nothing at all and wait for a patient with no complex situational needs to consider, even if you would waste the liver in doing so? You can also view this through the lens of pure cost. Money and time are arguably the 2 most valuable resources the NHS requires, and for public health initiatives that affect the entire population, no expense of either type can be considered lightly. Do you spend a fixed sum of money, for example, to provide everyone over the age of 50 with cholesterol-reducing drugs to prevent heart disease? Or do you provide complex cardiothoracic surgery to treat the 50 people who are most severely affected? As you may have noticed, the 4 pillars of medical ethics are not only complicated in their application alone, but can very easily contradict and interfere with one another. In fact, they often raise more questions than they provide answers. These cases are known as ethical dilemmas, and it is quite likely that you will be presented with at least one during your medical school interview. The problem is that there are usually no right answers as such, at least not in the way we are used to solving problems. You simply have to consider the scenario through each of these 4 lenses and decide which aspect is the most important to you and to any patients involved, remembering to come to a conclusion if you have been asked for one. Thank you for listening to this podcast. I hope that you found it useful. If you'd like to get in touch or for more free resources on medical school interviews, please head over to PostGradMedic.com or find the PostGradMedic YouTube channel. Thank you and take care.